The most frequent diagnoses for Biomag low-frequency pulsed magnetic therapy application include degenerative, inflammatory, and post-traumatic conditions of the musculoskeletal system which cause pain, impair mobility, lead to long-term sickness leaves, or even disability, as the case may be. These include osteoporotic, osteochondritic changes, arthrosis of large and small joints, arthrosis of the spine, painful radicular syndromes of the spine, and of course everything that relates to support for regeneration, especially the regeneration of cartilage, etc. Osteoporosis is a progressive systemic disease of the skeleton characterized by a reduction in bone mass. Bone mass with a worse microarchitecture is increasingly prone to fracture. It becomes increasingly fragile. In women, osteoporosis mostly starts to develop after menopause. The reduction in bone mass is accelerated by a decrease in hormone levels. Of course, a lack of vitamins and minerals, low physical activity, immobility, or impaired absorption play a role too. Treatment is always comprehensive. It includes hormonal treatment and mineral supplementation. Targeted rehabilitation should always be included. Application of Biomag low-frequency pulsed magnetic therapy is an excellent part of supportive treatment to maintain the bone tissue quality and reduce pain. It supports metabolic processes in the bones, leading to the better incorporation of building materials and minerals. Magnetic therapy improves the overall metabolic rate in these tissues, significantly accelerates healing, activates the formation of new bone tissue and calcification, and it increases sensitivity to parathyroid hormone. This all has positive effects against ongoing osteoporosis. Pain in the joints and spine due to degenerative arthritic changes start with initial affection of the articular cartilage. If we fail to prevent cartilage damage by early or ideally preventive treatment, the joint damage will become irreversible over time. After damaging cartilage, epiphyses, bone spurs, and osteoarthrotic changes can form. Secondarily, ligaments around the joints and soft tissues are affected. The cumulative damage leads to deformation of the joints, a reduction in mobility, and increased pain. Most often, large joints, the knee, hip, and shoulder, are affected by arthrosis. Many clients and patients suffer from osteoarthrotic and osteochondritic degenerative changes in the spine. Degenerative changes in the vertebrae and intervertebral discs with possible nerve root compression can occur. Aging, congenital changes in the joints, traumatic changes, overexertion, metabolic effects, and other factors are among the causes that contribute to the development of the disease. Rehabilitation should always be part of the comprehensive treatment of these problems. Arthrosis of the joints and spine are the main diagnoses for using Biomag low-frequency pulsed magnetic therapy, since it uses its analgesic, anti-inflammatory, anti-edema, and generally healing effects. The advantage of low-frequency pulsed magnetic therapy as rehabilitation for spinal and joint pain is the low level of contraindications and undesirable side effects. It does not burden patients and can be applied not only in hospitals, but even in home care, which is important for a wide range of chronic patients who can purchase devices for use at home. Magnetic therapy should be applied along with the application of other medical treatment or drugs. A wide range of applicators can be used. The range of Biomag products includes several dozen various types of applicators. You should always choose the applicator ideal for the particular spot and problem. Of the large joints, the knee joints are the most frequently affected by osteoporosis and osteoarthrosis, followed by the hip joints and shoulders. Joints become swollen and are in pathological positions. Secondarily, ligaments and soft tissues around the joints become damaged, which leads to deformities, a reduction in mobility, and increased pain. We must be aware of the fact that up to 90% of people aged over 70 are affected by osteoarthrosis. Comprehensive drug treatment, anti-rheumatics, anti-inflammatory drugs, is complemented by a whole range of so-called chondroprotectives, etc. Subsequently, if necessary, there is a range of surgical interventions that may resolve the person's condition, such as a total endoprosthesis, and this is followed by rehabilitation and spa treatment, including magnetic therapy and other rehabilitation methods. Osteoarthrosis of the large joints is one of the basic diagnoses for the use of Biomag low-frequency pulsed magnetic therapy. Magnetic therapy helps improve mobility and slows down further damage to the joints and joint tissues in chronic patients, and provides overall pain relief without further burden on the patient. It can be applied in home care, which is a great advantage for a range of chronic conditions. As far as the smaller joints, the Temporomandibular Joint is often affected. In such a case, arthrosis, trauma, or overloading of the joint when masticating cause the pain. Again, magnetic therapy can be used in a highly positive way. Painful damage to the tarsi or ankles is also common and highly limits mobility. This condition mostly includes severe pain that significantly limits mobility of the affected limb. We find such pain especially in athletes who have overexerted themselves, or in hard-working individuals who carry heavy loads, etc. Other causes may include diabetic neuropathy, which leads to pain in the tarsi and ankles. Treatment is always targeted according to the cause and complemented by low-frequency magnetic rehabilitation therapy. Heel spurs are a special group. They are sources of significant pain and greatly limit the patient's mobility. Apart from various treatment methods, using low-frequency pulsed magnetic therapy is of great benefit in this case. It can be applied to these patients before moving to other, more aggressive or surgical methods. If surgical intervention is necessary, magnetic therapy can improve nutrition of the tissues, prepare the body to better heal and regenerate. Subsequently, Biomag can be used to finish the healing and for a faster return to full mobility. Nerve compressions, radicular syndromes, so-called vertebrogenic algic syndromes, which comprise herniated discs with subsequent nerve compression. These are all very common diseases which trouble many people, including young ones. They represent damage to the cartilaginous intervertebral discs, which consist of a rigid outer envelope and an inner gel-like core. The core can move to the side, which causes compression of the nerve root. A bulging disc may occur, disc protrusion, or herniation of the disc into the spinal channel. A herniated intervertebral disc or osteophyte compresses the nerve root. Acute and chronic painful radicular syndromes appear, such as cervical dysfunction, cervicocranial syndrome, vertebrogenic syndrome in the spinal area, cervicobrachial syndrome, radicular syndrome of the whole upper limb, pain in the lumbar area of the spine, so-called lumbago, sciatica pain in the sacroiliac area, etc. Lumbosciatica syndrome, acute sciatica, is one of the most common forms of compression. Ischium nerve plexus compression in the lumbar and sacral area of the spine, with pain radiating to the lower extremities, intense acute pain, and limited mobility. It is most often caused by a sudden movement, lifting a burden, a non-physiological position, etc. Lumbosciatica syndrome can frequently develop after cold, which causes neuritis ischiadica, painful contractions of the muscles along the spine, which worsens the disease and significantly limits mobility. Pain is projected to various parts of the lower limb, depending on which part of the spine the nerves were compressed in. The analgesic, muscle relaxant, anti-swelling and regenerative effects of low-frequency pulsed magnetic therapy can be beneficial in all vertebral pain syndromes, with the location making no difference. The aim is always to provide relief from pain, to allow further mobility rehabilitation, which would not be possible without prior pain reduction, to achieve an alignment of the non-physiological anatomy of the spinal cord, to eliminate nerve root compression, and to support subsequent healing, which is a necessary condition for the long-term effect. Apply the program repeatedly, even for several hours a day, until relief is achieved. Unfortunately, magnetic therapy alone cannot remove existing anatomical changes, which may require surgery. However, apply magnetic therapy both before and after possible surgery, during rehabilitation and recovery, to accelerate the healing and regeneration of tissues and a return to full mobility.